Surgery can be a scary process for patients, but with the help of PT Genie coordinating a cohesive treatment plan following the surgeon's protocols and working with their in-person physical therapist, the patient can achieve maximum recovery at a faster rate. This process starts the moment the patient walks through the clinic doors. Once a surgeon deems surgery is appropriate, they will advise the patient schedules a pre-surgical evaluation with the therapist, who will help them understand their role in the recovery process before and after surgery, and perform various assessments to comprehensively illustrate their injury. This is where the physical therapist can leverage PT Genie's 3D technology to assist in assessing patients' pre-surgical status and then comparing it to their post-surgical measures. Once the pre-surgical evaluation and assessment have been completed, the next step is to get the patient registered for PT Genie's monitored home exercise program. Registration can be done by the therapist or at the front desk utilizing the simple QR code found on the handouts in office. With the scan of a QR code, the patients are brought to a registration site that explains the program, reiterates the benefits of the program, showcases the care team, and allows the patient to schedule their registration call with the onboarding specialist. The patient will receive text messages and phone call correspondence attempts if they do not reach out to the PT Genie team first to get registered for the program. Ideally, for surgical patients, we want them onboarded and testing out the application prior to having surgery. Non-surgical candidates can start the program within 24 to 48 hours of their onboarding call. At the patient's post-op appointment with the physical therapist, they will review the patient's PT Genie profile to find out how the patient has been progressing since surgery. The ideal treatment path, when appropriate, is our hybrid model. This is where the patient attends traditional physical therapy in office while PT Genie monitors their home exercise plan, provides PT televisits as needed, and attends to questions or concerns the patient may have while in limbo between visits to their physician. PT Genie helps close the gaps in care when patients are most vulnerable to re-injure themselves.
Deep breath. You've got this.
Patients log into the app daily to perform their monitored home exercise program. The range of motion and pain measures are driven back into our system for our team to monitor and update appropriately per patient needs.
Keep it up.
Our PTs schedule PT televisits on a weekly basis to assess progress, make plan of care adjustments, and create new patient goals.
Almost there. 2 more to go.
While our CSS team members monitor exercise progressions or regressions, answer patient messages, and schedule weekly calls to review exercise with the patient. The patient returns to the clinic as needed for further 3D motion assessments and hands-on care. When the patient can be treated virtually based on a strategic timeline procured by the care team, they can go fully virtual with a combination of telehealth visits and remote monitored home exercise program. Secure messaging and updates allow the patient and the clinical team to be in sync between appointments, providing a concierge program that is typically covered by their insurance and keeps the patient safe, on track, and provides them with optimal results.
You've done a very nice job with your therapy here in clinic, but in order to get you back to doing everything you want to do, what PT Genie really helps with is that bridge between being done with therapy but getting back to all the fun things you like to do, like yoga and taking care of the garden. So what I would like you to recommend to do is keep with your exercises on here. If you have any questions, you can reach us at any time through the app using the message feature, as you've done before. Right down here, you see that little chat bubble? You click that, you can send us a message at any time. Any questions, You'll still interact with your CSS, and you can give them any questions you have as well, and they'll progress you so that you can do all the things you wanted to do in the presentation. Good, okay? All right, very good. Well, you've done very well.
We provide the virtual connection between the patients and the providers with a simple-to-use app. Patients feel like they have someone to reach out to when they're home alone after undergoing surgery or an injury. They feel included in their care, knowing that someone is overseeing their progress even between clinic sessions. This keeps home exercise program adherence rates to levels 5 to 10 times higher than the national average, which means quicker relief, faster results, and happier patients. Genie Health can turn your clinic into a hybrid solution for patients and allow them to get back to what they love doing.